The rise of right-wing extremism in the United States has been on experts' radars for years. And look, at Massachusetts is no exception. As we saw the weekend before last, around 24 members of the Worcester-born neo-Nazi group stood outside Brigham and Women's Hospital with a large banner claiming the hospital, quote, kills whites. And they passed out flyers with the names and photos of 2 doctors working on health equity for communities of color, claiming they're pushing, quote, anti-white genocidal medical treatment policies. Unfortunately, it's just the latest instance of threats leveled against doctors Michelle Morse and Brigham Wispelwey and Brigham and Women's at large. They started last spring after the pair published an article in Boston Review titled An Anti-Racist Agenda for Medicine. GBH News investigative journalist Phillip Martin has reported extensively on this story, and he joins me now. Phillip, first, great to see you in person.
Sue, it's a pleasure seeing you in person.
Let's talk about this. This is shocking on a number of levels, except it's not new. But first, tell me what these 2 doctors have been working on, what their agenda is, what their public health view is.
Well, they both come from, they're internists and public health physicians, and they come from a position of community and looking at exclusion. And one of the areas of exclusion they looked at was in cardiac medicine. And what they found was, working with a group of about 15 other doctors, in 2015, they discovered, going through data, that as Black and Latinx patients were being admitted to Brigham, they were, for cardiac conditions, serious cardiac conditions, many of them were being seen in general practice. More of the white patients, considerably more white patients, according to the data, were being seen in cardiac medicine, a specific area of the hospital. The result was that you had much worse outcomes for people of color than you had for white patients. And they saw this as a form of institutionalized racism and decided to do something about it based on their core philosophy, which is equity. And if you wanted any better example of how to achieve equity, it had to occur in an area where the majority of serious cases were related to cardiac unrest.
And I don't think, I mean, you'd have to be living under a rock for the past 400 years to not know that this was happening, right? And especially, we've looked at studies of women who have been treated differently than men have been treated. Medical science has been working hard to be fair and equitable in treating their patients. So what's the point this neo-Nazi group is trying to make? How is this killing whites? How is spreading health care to everyone in an equitable fashion, how is that taking away from treating white people?
I think let's address this in 2 ways, Sue. I think the first way we should address this is they don't believe this. And if they do believe it, it's irrelevant. Because what they see is an issue that they could take advantage of, glob onto. It's something that Donald Trump said at a rally several weeks ago. And Donald Trump got his ideas from the right-wing media sphere, where this idea of by creating equity in medicine, you're somehow taking away from white patients, has become, like a lot of things in the Trump sphere, a lie. These falsehoods have taken on a life on their own. Mythology that politicians see advantage in. It's pretty much like the mythology that's been of critical race theory. What it's become in the minds of many reactionaries, many on the far right, and the far right, of course, has become the normal. It's the mainstreaming of extremism, is how I like to put it. So they can't be taken seriously. Andrea Cabral on Boston Public Radio put it succinctly. This is these individuals trying to take advantage of a situation of a mainstream talking point within the reactionary, conservative, right-wing media sphere that they see as advantage.
I probably, like you, I feel like I don't want to give this group too much attention because they don't seem like a big group. They're obviously looking for something to hook onto, but I do want to talk about them a little bit. One of the things that we've seen evolving over the decade is the way that these neo-Nazi groups have been presenting themselves. It's like they've taken a page out of almost every group that has worked to get acceptance, putting on khakis, not using a swastika, really presenting themselves as this normcore, normal group of guys who just happen to be out protesting in front of a hospital on a winter day. Can you tell me a little bit about who they are and where they come from?
So you hit the nail on the head. If you look at neo-Nazi groups around the country, like the Patriot Front, they have basically taken a page from nationalist socialist movements in the United States. Not the Aryan Brotherhood so much, that's a group inside prisons, but other groups. And they have basically decided, like David Duke, for example, with the Ku Klux Klan, to drop the hoods. And this way, they're dropping the swastikas, you're right, substituting it for other symbols. And the person who started this group called the Nationalist Social Club might sound innocuous to some people. This is an individual named Chris Hood, who was from Worcester. 2019, they started this group, according to the Anti-Defamation League. He's been kicked out of everything, including other neo-Nazi groups. He was kicked out of a group called the Base for theft. And so he decided to found his own club. And they have largely been unsuccessful. They exist basically to pass out flyers and stickers and to protest in front of hospitals. And their hope is to grow. And this group has been around again since 2019. They have chapters throughout New England, relatively small. And they have chapters apparently in France and Kentucky and a number of other places. And so what they represent might be a small organization, but the Anti-Defamation League says they've experienced some growth during the Trump period, during this period of in the post-Trump period. But they started to experience growth, like a lot of neo-Nazi groups during the Trump period, where you had groups grew from 99 avowed neo-Nazi organizations to 121 in the United States, according to the Southern Poverty Law Center. And this is just one of them.
Yeah, let's talk a little bit about the doctors. I mean, we're
Sure.
in a world right now where doing a regular job, like being a teacher, working as in the election department in your hometown.
Librarian.
Working as a librarian, working as a kindergarten teacher, working as a doctor, has now suddenly put you in the public spotlight to be getting death threats, to be fearful that you'll be fired for just doing what your mission is to do. How are these doctors reacting to this attention that they're getting?
I've spoken to quite a few doctors, in addition to the ones featured in the article. Many of them, of course, are concerned about their own safety, but they are not so concerned that they're going to refocus their attention on something else. Those who are focused on equity will continue to focus on equity. Dr. Morris, for example, who leads a large equity network, medical equity network in the United States, she, looking at her social media feed today, hundreds of new followers. And hundreds of people saying we will not be deterred by the actions of neo-Nazis and other extremists and their supporters within conservative circles. These neo-Nazis are gaining fuel from the politics of white grievance. They're taking advantage of that. And these doctors have basically said, yes, we are concerned about our safety because violence, we saw with January 6th, has been normalized. You have Republican politicians who will not speak out against these things. You have neo-Nazis in Florida right now. You know about these incidents, where the governor of Florida has refused to condemn neo-Nazis, decided to condemn the Democratic Party that's condemning neo-Nazis rather than to condemn neo-Nazis. That's where we are right now.
You know, if we had said to each other 10 years ago, you know, in 2022, there's going to be a lot of attention on healthcare. Right? There's going to be a lot of, you know, interest about it. We're going to be pushing to get a new medicine, and you know, we would probably have had a more optimistic viewpoint as what would be happening. But to that point, COVID has unfortunately shown us in real strict data terms the inequities that exist in our healthcare system and the challenges that people who should know otherwise in terms of getting vaccinated and their resistance to get vaccinated. as we get through this, do you think this is an opportunity for Americans to really see what the lay of the land is, how things are broken, and hopefully we'll come out of this with a more optimistic plan for both, equity and for our medical community?
It's a great question. I think if you think about it, Sue, if there are individuals who refuse to accept facts, objective reality, who are being flooded with disinformation, you will win over some of those people. But a lot of people who are basically committed to a particular point of view, a frame of reference, are no longer persuaded by this thing we call facts. Facts be damned in the context of even medicine, in science, things that are observable, empirically determined, so on and so forth. So as far as optimism, it's not for me to say. I can say that it seems problematic that we will have a lot of people basically transitioning to the side, if you will, of objective reality, when in fact they're invested in disinformation. And I would say, just finally, if you will, that you're right, the COVID situation has divided people, but it's actually people who have divided themselves between facts and disinformation.
I was struck by this group. Obviously, anytime there's neo-Nazis protesting, I'm struck by them. But at the same time, as we look at the public health plan to try and get more people vaccinated, the group that continues to be hardest to reach, according to many surveys, is white men who live in red states who are likely to have voted for Donald Trump. And this is the group that looks like was out there protesting that, whites weren't getting health care treatment. The irony and tragedy of that message by that group, when they could be preaching to their other neo-Nazi brothers and sisters to get vaccinated, and that would probably do more to help their cause than this. Not that I want to help them, but my point being.
Your point makes sense. Though I would say, in terms of the demographics of who is attracted to this movement, it's actually across states, blue and red, and many folks who live in areas that are, in their view, being contested, that are where they're being replaced. In other words, urban areas and blue areas. That's where you find some of the greatest growth among neo-Nazis and conservative forces to the far right. And in terms of whether or not they will, again, see themselves under siege, well, you have talk show hosts, as you know, conservative talk show hosts who've died by several dozen, I understand. Mm-hmm. Conservative talk show hosts, mega church leaders, evangelicals, they've died and they haven't had that come to Jesus moment when it comes to COVID. They have not accepted that it is something that's killing them. And so I'm not sure how much the objective debilitation, the right in your face type of problem is actually going to persuade these individuals.
All right, Phillip Martin, I appreciate your work covering this important topic, and as always, we'll look to you for the latest as we follow it. Thanks for joining me today.
Thank you very much.
Great to see you.
Much appreciated.